Ready?
Let me just adjust my headset. Okay,
All right.
ready.
I don't have any hair to fix.
I'm like, I just rolled out of bed an hour or two ago.
All right.
Recording in progress.
Alexander King, thank you so much for being with us today.
Thanks for having me. I'm excited to be here.
Alex, can you just start telling us what you're doing right now? Like what your role looks like, what your day and your week looks like, and what your title is.
Sure. So, currently an associate professor at Rowan Virtua SOM in the OMM department specifically. Been here for about 5 years. I'm also a second year OMM course director. I'm also a residency program director as well as medical director for the Neuromusculoskeletal Institute in Sewell. And we have 3 branches right now. So I'm one of the branch directors. But yeah, I think my day to day is very diverse. I, see patients Monday, Wednesday, Friday, full time. Um, about 15 patients a day, doing a combination of acupuncture and OMT. And then I also Tuesday, Thursday, teach in labs, direct labs, and ranging from first year to second year students. And of course, I always have third and fourth year students and residents on rotation with me when I see patients. So a lot of teaching, a lot of patient care, and I'm on the verge of starting the first inpatient OMM consult service at Virtua Voorhees Hospital in New Jersey, in the next month or two for my residents, just so they get the inpatient experience. And that's kind of the latest project I'm working on, academically speaking.
Amazing.
Yeah, it's a
Super
lot.
cool. That's full. That's a full schedule.
Yeah.
So I was thinking about our interview, and
Mhm.
sometimes I talk to students or mentors about OMM specifically, and talking to students about OMM, specifically pre-med students.
Mhm.
So, I think most pre-med students thinking about osteopathic school are thinking about a career in medicine. They read up on osteopathic medicine, and the philosophy sort of feels right to them,
Mhm.
and they read up on OMM, but sometimes I think it's hard to really get a feel for what OMM is.
Yeah.
Can you explain to our pre-medical student listeners what OMM is and what its importance is in the universe of osteopathic medicine?
I think the definition of what OMM is can vary and change depending on your experience with it. I think if you're talking textbook definition, it is, the use of a DO's hands to diagnose and treat illness and pathology using your knowledge of anatomy and physiology. Now, what that really means in practice is it is the act of using human touch to heal somebody, um, and to understand somebody too, on a more fundamental level than just conversation and talking, which is what we teach. Getting a history, doing a physical, but it's a step past that. I think it's a more, I guess you could say, like spiritual based practice, not in like the spiritual of like, AT still talked about the divine and life force and all these things, but it's more of like that humanistic spirit of, hey, I'm trying to help you. Let me use my hands as a human being to another human being to feel what you're feeling, and then to use my privilege in that knowledge of anatomy and physiology to help correct back towards that balance or towards that healing perspective in terms of parasympathetics, for example. So you can really go down the rabbit hole of how it works on a quantum physical level, which I think is pretty past what a pre-med needs to understand. But I think that's just the major difference is we get hours and hours, hundreds of hours of formal education in palpation, human palpation, and human palpatory treatment, um, which just separates us and creates what a DO is.
Awesome. That's great. I mean, I don't think I could have done a better job explaining. And for me, I actually got a lot of benefit watching your YouTube video,
Mhm.
your YouTube channel, and the videos that you have on that channel. Can you talk to us a little bit about what made you decide to start a YouTube channel, and what pre-medical medical students, practicing physicians can learn from your channel, and what type of content you're putting there?
Yeah, I got the idea years and years ago. I've been watching YouTube since I was a kid, or really since it came out, um, and it really has evolved to a great educational platform. In the past it was just like funny memes and cat videos, but now it's really a huge, cultural database of interesting people living their lives, teaching, and I think there was a huge void, and still is, of what does the life of an osteopathic, specifically an OMM specialist, look like, and what do treatments look like? Because a friend of mine, Chris Medina, he has a great channel, Osteopathic Clinical Skills, which shows like the textbook way to do specific diagnostics and approaches and treatments, and it's really excellent for learning, for boards and in the classroom. But what I like to showcase is my approach past that. That I teach real clinician, my residents, what I was taught clinically, let's say post residency, just like what is a true osteopathic treatment from head to toe, including the cranium, including everything in the feet all the way up. I don't think there's many videos that showcase the, let's say, American osteopathic approach, because of course there's osteopaths all over the world, and it's a very geographical based thing. And I just wanted to showcase my approach so that people could see it and have a better idea of what is the end goal. There's a lot of students, when we teach it in lab, they get lost, in the leaves, let's say, and don't look at the forest as a whole. They're just like, oh, this technique is for this technique is for this, and it gets quickly disjointed and not as applicable to a case, let's say. So I like to show, hey, if there's someone coming to me for low back pain, this is how I'm going to spend 20 to 30 minutes just evaluating and treating them osteopathically. But also, I like to give my thoughts on unique cases that I've treated. Like I just posted a video last week about a Portuguese man o' war sting case that I treated successfully, and it's ongoing and it's evolving. But there's really nothing about that, about an osteopathic approach to treating this specific type of pathology. So there was a big, I think every time I post, people are appreciative. I get comments all the time from pre-medical students to osteopathic students who are like, hey, I watched your video and this made me actually want to pursue OMM or want to be more interested in osteopathic medicine, which was really my whole goal, to just spread that knowledge to the general public and anyone who's interested.
So, Alex,
Mhm.
springboarding off of that,
Yeah.
can you tell us, we know that manipulation and manual therapy is excellent for lower back pain. Outside of that, what type of patients would you generally see on an outpatient basis? And you mentioned that you're starting an inpatient service. What type of patients would you see inpatient?
Yeah, outpatient, it is true that there is a typical patient panel of an OMM physician. However, I like to say, if you're a human, I can treat you. That's the only qualification. Like, even if you don't really think like, if you think you're relatively healthy and don't have things, I promise you, I can find things that have been covered up by your body or that have been nagging, but in the background. And then after you get treated, you're like, wow, I didn't know I could feel like this good. I thought I was fine. And then until I like leveled up, so to speak. Um, but I think mainly, pain conditions is probably the first thing. I am at a pain institute, where people come in for neck pain, back pain, let's say post-operative pain. I've treated people with, prior CVAs and motor vehicle accidents and a lot of traumatic injuries. But I even treat kids. I treat, a lot of athletes who want to be optimized, and geriatric patients who, are just, they have their chronic aches and pains as well. But also the special needs population, patients who have autism, patients with cerebral palsy, with a lot of rare conditions as well, kind of come in because they've been evaluated elsewhere by neurology, by ortho. They don't know what to do, so they're like, just go see Dr. King. He'll figure out something. And I actually really like those cases because it gives me a chance to be creative and to utilize evidence in a newer approach that hasn't really been explored. Hence why that Portuguese man o' war sting showed up at my door. I was like, this is cool. Not for them, but interesting for me to treat. So that's outpatient. And then inpatient, every OMM resident needs, I believe, about 50 or so inpatient cases in their logs. And what we treat in the hospital is kind of similar, really pain from just being like static, just laying on their back the whole time. People get in pain just from being immobile. PT does get them up and walking around, but oftentimes that doesn't quite do the trick, and they need actual manual treatment to address, headache. Their ribs aren't moving well enough to increase their blood oxygenation, which delays healing, and gastric ileus, pneumonia cases. So there's a lot of inpatient applications, and even when I was rotating up in the Bronx at St. Barnabas, they treat all of the infants that were born like that day, and then they treat the moms as well, as long as there's no contraindications to treatment. So inpatient wise, it is more acuity, it's slightly different, and you do have to be very cognizant of absolute and relative contraindications. But that's why we train our residents there. It's like that higher level of treatment.
So, Alex, I want to talk a little bit about complementary medicine and specifically start with flipping it around a little bit.
hmm
So, a lot of times we talk about manual therapy and OMT complementing
Yeah.
standard medical care. Can you talk to me a little bit about standard medical care complementing normal, standard therapy, i.e., I've definitely seen dentists and chiropractors where they pick something
Mhm.
up that's abnormal and refer, to standard therapy. But one of the pros to osteopathic medicine is that, DOs in the US are completely trained physicians. Can you talk to us a little bit about how your full medical training has assisted you, maybe in specific cases or in general, when it comes to referring patients out for other evaluations or therapies while you're treating them with OMT?
Yeah, I think a really good example is that I had a patient show up when I was a resident, chronic low back pain. And he'd been having this pain for about a year and a half. Um, he had been to chiropractor for literally like 8 months prior to seeing me, and it just wasn't getting better. He's like, yeah, it felt better for like a day, and then it would come right back. And then in digging into his medical history, I was like, so yeah, tell me about other symptoms, like, any other weird things going on, any, nausea, vomiting, diarrhea, weight loss, all your review of system questions. And he was like, well, I have been kind of losing weight. And I was like, tell me about that. He's like, yeah, I've lost about, 10 pounds in the last couple months. And this wasn't a big guy. Like, he didn't have 10 pounds to lose. And I was like, that wasn't on purpose or anything? He's like, no, it's just kind of like maybe I was eating less or something like that and working more. And, and to me, that's a red flag, of course. I'm like, could this be a metastatic cancer or a lesion that's, causing his metabolism to increase? So, of course, we get x rays. And wouldn't you know it, he did have Mets from prostate cancer in his lumbar spine. And he'd been going to a chiropractor just getting adjustments. And very quickly, obviously, I referred him to oncology, and I didn't see him after that. So I just hoped for the best that he was getting the proper treatment after I saw him. But he did have a delayed course of care and diagnosis because he didn't get the proper initial evaluation. He just hopped right into a chiropractor's table and thought that would fix it. Of course, the chiro didn't ask any review of systems or medical based questions. So that is something that I tell my residents. I'm like, this is why it's important for us to do the work as a physician first. It's like you got to check all the boxes, ask for these red flag signs. And that's why I think it's important that, people who are having pain, rather than just jumping to, let's say, a mid-level or to just someone who sets up shop on the street, see a physician. Like, even though it might take a little bit of time or have a little wait list, I think it's important to have someone with the knowledge base that we have to just make sure that you're okay, that you're not just delaying care of something that could be severe.
All right, Alex, that's
Mhm.
great. And my follow-up question on complementary therapy is you mentioned acupuncture as a treatment, which is obviously a different complementary therapy and not generally taught in osteopathic medical school. Can you talk to us about your openness to other complementary therapies and how you got involved in those therapies and where you think their place is in osteopathic medicine.
I think what I really like about osteopathic medicine is that open-mindedness and that openness to newer treatment modalities and to integration of other therapies. Because ultimately that's what I think drives innovation and better healthcare in the long run, is that openness to like, hey, if this unique approach is better, maybe we investigate, do some research, and integrate that into our practice. So, you know, I always like to think if AT Still was still alive, he'd also be an acupuncturist, because it is very osteopathic. I think you're literally directing energy flow and enhancing parasympathetic balance and autonomic balance to create really a healing response in the human body. When you do acupuncture, you have a big endorphin release, a lot of changes in the central and peripheral nervous system to enhance healing response and to calm down the body. And then you sleep extra long that night and you wake up feeling really, really good. And I think in combination with osteopathic hands, it's a very, very powerful healing modality that we're learning more and more about as the years go on, as our research gets more refined, because it affects so many things. Because of just the way the human body is you know designed, if you want to say designed, just the way it can harness energy, specifically literally like electron activity based on the needles you're putting in. Something just resonates with that physiology to create a better healing response. So I use it a lot for athletes, for people who are recovering from surgeries, for people who are just functionally have something wrong like chronic migraines, IBS, where there's an autonomic imbalance, even PTSD, fight or flight response that has gone haywire. It's used heavily in the military. So I think really we're just getting started in terms of the cultural openness to acupuncture. Every year my services are more and more in demand. My wait list now is like months and months long, which is great for me, but not so great for patients who need more acupuncture care. And I think more physicians should be open to training in it and using it. But I'm kind of already I bought in very early because my grandfather was an acupuncturist from Korea, so it's just been a family approach, I guess you could say, for a long time.
Alex, can you tell us? I met you at OMED,
Mhm.
which is the big osteopathic conference, and you were like a rock star at OMED. I feel like everywhere you looked, you were speaking, you were doing a great job promoting osteopathic medicine. Can you tell us a little bit about your involvement in the AOA, what you think the importance of the AOA is to osteopathic physicians, and where you see yourself being involved with the organization in the future?
It was from years ago. Dr. Caudle, Jen Caudle at Rowan, she's super involved. She's big on the news, so got a lot of YouTube followers, and she's kind of like my mentor. And I asked her when I started at Rowan, I'm like, hey, how can I get more involved just nationally and with the AOA and promoting osteopathic medicine? And she was like, here's a number, just reach out to them. And it actually was Ernest, who's the social media head at the AOA. And he started sending me articles here and there to comment on. And then I was like, hey, listen, like I love speaking, I love getting in front of a camera, like could that be an option? And he's like, yeah, let's figure something out. Like and that was years ago, and it never really took off until I actually went to ECOP recently as a representative of the OMM department. Hey, Leo, my cat keeps wanting to participate. Sorry, buddy. And I saw Teresa Hubka, and as the prior AOA president, she was there attending and talking to all the ECOP, or the Educational Council members, which the other big chairs of OMM across the country. And we were all debating, like, why is OMM why hasn't it really taken off, or why is it still so niche, and why are we, like, what are we doing to promote it? And I kind of stood up and gave my 2 cents of, we really need to embrace the younger generation of DOs, of medical students, of pre-medical students, Gen Z, Gen Alpha, even Gen Beta now. I have a daughter who's technically Beta. And because I really think that they're the prime generation to embrace this approach to medicine because they are very humanistic at their core. They really care about people. They're very active socially, social justice, and really want to help. And I think we are positioned as a profession to really teach them, about the osteopathic approach and how this is the future of healthcare. Because let's face it, every year DOs become more and more a part of that physician base in America. In what, 1 in 4 or so med students is a DO student now, which is crazy to think of. So we've come a long way, but I really don't want us to be kind of watered down just because we're expanding so much. Like, I want to preserve that osteopathic heritage. And once I was kind of gave that random speech to all the ECOP members, Dr. Hubka came up at the end, when we were done, and she's like, "Okay, so you're coming to OMED, right?" This is 2 weeks before. I was like, I wasn't planning on it. Let me ask my wife first, get clearance. My chair was there, and she's like, "Oh yeah, you should go. You should go." And so, in talking with Dr. Hubka, I'm like, "Okay, I want to go. How can I help when I do show up there?" So what happened was she put me in contact with the AOIA, so the informatics arm of the AOA, and they are working on all of these projects to expand the reach of osteopathic, osteopathic influence in the digital sphere. So, and then I met with Ernest as well, and I had like this idea of being the OMM correspondent, where I'm like boots on the ground, interviewing people, man on the street type stuff, because I love it. I love watching it. I think it's funny. I think you get really genuine interaction. And so this is kind of the first OMED where I piloted that approach, and I think it was successful and people liked it. I also did guerrilla marketing, so I made my own hats, that say OMM saves lives, and that was a hit. Like, people were like clamoring to buy them. I still haven't created a store yet. They're in short supply and very rare and limited edition. Perhaps I'll keep it that way. But so I just like marketing and sales and have a lot of ideas of how we can actually market and sell osteopathy and OMM to the masses and to people who might want to pursue that.
I think it's awesome.
Yeah.
I think you did a great job at OMED. I was excited after getting home to watch your videos also.
Thanks.
You're awesome. All right, Alex, we're going to switch gears a little bit. Can
Mhm.
you tell us where you grew up, where you went to college, and when you decided you want to go to medical school?
Yeah, I grew up in Great Falls, Virginia. Some people would say Nova. Sometimes I just say DC because it's shorter, but I was born at GW Hospital. Mom was a practicing child psychiatrist. Dad was a chef and culinary professor at the local college. So, I grew up really doing a lot of sports, a lot of music, and a lot of like visual arts. I loved to draw as a kid. Since age 3, my mom would really see that and would just kind of like nudge me towards that direction, buying any art supplies I wanted, let me color all over the place, make a mess, whatever. I actually wanted to be an architect from when I was really young because I was just a huge Lego person. Like, I'd just sit down and play with Legos for hours and hours. And so that was kind of like my intro into creativity, into like creating things. I really like it, and I still love it to this day, which is why I still try to do art here and there when I can. And then, did soccer my whole life, played the violin, the saxophone. And what's interesting is looking back, all of these things were like all fine motor skills, right? That's where I love to fidget with things. Like, I have like magnetic fidget pens here. I literally got this fidget spinner for myself, very fancy, right? But I just like the tactileness of just creation and doing things. So when going into high school, I was taking art classes. When I applied to college, pretty much everyone at my school was like either UVA or William and Mary. I applied there, but I didn't want to go to like a massive school. I like the more like personalized small school vibe. So I looked a lot at Pennsylvania and all the schools in PA, like Ursinus, Juniata, Dickinson, Lafayette, Lehigh. And then I was reading a book called Colleges That Change Lives, and Muhlenberg was in there. I didn't really know much. I'm like, Muhlenberg, that's a weird name. The mules are the mascot. I don't think that's very cool, but I'll check it out. So I took the tour. It was funny because when I took the tour, I was like, it's nice. Allentown, Pennsylvania. Like, I don't know if I want to be in Allentown for 4 years. No, no disrespect. It just wasn't on my radar. I visited Lehigh. I was like, oh, Lehigh's kind of cool. And then, of course, you're weighing the options of like who's giving me scholarship money and all that stuff. So they gave me a good chunk of change, and I was like, you know what? I actually do kind of like this school. I think it'd be a good experience. So I went to Muhlenberg, and actually it was like the best choice I ever made. I mean, not to be an advertisement for the school, but they don't pay me or anything. But I met some of my best friends to this day at Muhlenberg. I started a fraternity from chartering to now it's still there, and they have a house and everything. And yeah, it was a great experience in just expanding my horizons in leadership and networking and becoming a person. I majored in neuroscience and fine arts and sculpture there. So I got to really pursue a unique path to me. Not to mention, they had a phenomenal pre-medical advisor. Shout out to Lori Provost. I think she's retired, but she was the one who was like, hey, listen, like your portfolio, because I only knew MD. Like my mom's an MD, all my aunts and uncles, my grandfather, who was the first doctor in our family, they're MDs, but that's all they have in Korea. So when they came here, they were like, they didn't know about osteopathy. But my advisor was like, you're literally like the prototypical DO. And I was like, a what? Like, how do you spell that? And she was like, well, you use your hands, you're good at art. We're really close to PCOM. A lot of our students go there. And at the time, Dean Veit was from Muhlenberg, and he was PCOM's dean. So I was like, okay, I mean, it sounds cool. And I did some research, and I was really interested. And so I applied, and they interviewed me, and that's how I got involved in the osteopathic profession, was literally by my pre-med advisor. I guess she really did do her job properly in advising me in the right choice. So if it wasn't for her, like I don't know if I would be sitting here, which is pretty cool. But yeah, so that's kind of my story.
So you knew you wanted to go to PCOM. Did you apply to other DO schools? Did you look at other schools, or what was your thought on that?
I'm trying to remember. Honestly, I think it might have been the only DO school, just because my advisor was like, "Hey, listen, it's really close by, and we send a lot of students there." And it turned out 2 of my fraternity brothers and then 2 other females in my class, we all got into that. So I going in, I knew 5 people, and I had roommates set already who I'd known for 4 years. So I was like, "Oh, this is great. This is just an extension of college." Like I'm with my fraternity brothers as roommates, like, which may or may not have been a great idea, but it's how it was. Now my buddy Samir, he's pulmonary critical care in Lehigh Valley, so he's still back in the area, and we keep in touch. So I think it was like the one school I had my eyes on. Yeah.
And what did your mom was an MD? When you went back to her and said, "What do you think of osteopathic school?" What was her response?
She was really excited, because she's like, "Oh my gosh, this is what your grandfather always preached." He always preached, first approach to health is your diet and your exercise. And that's just like this old school, he was an herbalist, he was an acupuncturist. So in Korea at the time, they don't have pharmaceuticals. They literally have herbs, and they have your food, and then like how much are you getting up and moving around. So that was his approach, and he's an MD. So even though like they have the MD letters behind their names, they're thinking osteopathically, but more based on the traditional Chinese medical side, which is still a very kind of osteopathic way of thinking. So she was really excited. She's like, yeah, I mean, she was supportive and was like, you should go for this because it fits you completely.
All right, Alex. So tell us, when you got to PCOM, when did you really discover that OMM was your passion? And did you always know you wanted to do that for residency, or tell us how your application after that went into postgrad?
Yeah, it was a very it was not my first choice, and I actually had shadowed orthopedic surgery for years in college. Like I was like dead set on it. Um, my mom was friends with the orthopedic surgeon for the at the time the Redskins, which is now the Commanders, of course. And I had shadowed him doing, knee replacements, hips, shoulders, everything. Um, but in getting into rotations, I would, I always kind of felt weird in the hospital, and I actually learned during medical school I have synesthesia, which kind of explains a lot. Like I have a lot of light sound sensitivities and like sensory things. And the hospital just kind of took a toll on me. Like I would be super like frazzled by the end of the day, like, all the fluorescent lighting and all of the commotion. And I was like, I don't know if I could practice in the hospital and in the OR constantly. So it kind of ruled out surgery for me. I knew if I wanted to be, in a low stress kind of have a low stress lifestyle, I should be outpatient just for my own sanity. And then I was looking into sports medicine or PM&R. Like, oh yeah, these things fit with my love for biomechanics, for sports, for performance. Um, and I can do OMM in these things. And I, through the years of doing OMM lab, I just loved learning the techniques and treating people, and actually was like creating my own techniques because I thought it was really fun. So I always kind of was looking for that specialty that I could fit OMM into. So I was like, perfect, family med or sports med, PM&R, these things really embrace OMT, and I could seamlessly integrate that into what I do. Um, but I never really thought about just purely going into OMM as a residency up until I was having conversations with uh, the faculty at PCOM, who are big mentors of mine. Dr. Lauren Notabell, who's the program director, still is the PD. And talked to Evan and Alex Nicholas, of course, big names in OMM. They wrote the book, The Atlas, on it. And Don Allison, David Fuller, all of these really knowledgeable DOs who use OMM day in and day out. I was asking them, I'm like, hey, what if I just went into it as a specialty? And they were like, well, yeah, you can. It's just you got to make sure it's really what you want to do as your main focus. And I was weighing, family medicine or internal medicine, maybe doing OMM as like my additional +1 fellowship year. But I think what it came down to was like, what do I want to do all day, every day for every patient? And it's OMT. Not super interested in like primary care necessarily, but I like in that getting an OMM board certification and doing that as a residency, I have a lot of options of bringing things in, like acupuncture, like injections, which I've trained in. So I kind of went with the OMM residency route and then made it my own in terms of how I approach patients.
So where did you do your residency, and are there a lot of programs for OMM, or how is that application process?
Yeah, so I stuck with PCOM for my residency. They accept one resident in they have two programs. There's a 2-year program and a 1-year program. So globally, the way OMT residency works is there's 3 options, and I think they got the names kind of backwards. There's the ONMM 1, and the ONMM is technically a specialty, or osteopathic neuromusculoskeletal medicine. So the ONMM 1 is full 3 years of integrated OMM. So you have your internship year, then your 2 advanced years. Then you have ONMM 2, which is what I did, where you find a TRI or an internship anywhere in the country, and then you do your 2 advanced years at the same institution. And then I'm the program director of an ONMM 3, which is your third option, which people call it a +1, where you can do any residency you want, fully complete it, and then do an extra year of OMM intensive training to get board certified. So currently I have 2 family medicine chief residents who graduated last year who are doing their +1. They're halfway through it. That's the one program we have. PCOM has the O&M 3 and the 2 programs. So they typically have like a +1 fellow and then a resident. And the current resident, Dr. Lauren Fondy, is one of my prior students who I was like talking to her a lot about her choices of where she wanted to be. And she wanted to go the same path that I did. So she's currently their resident now for OMM. And there's a lot of programs around the country, and honestly, many of them go unfilled. So if you're listening to this and you're like, this really interests you and you're not sure where you want to go, I would really consider pursuing one of these programs, because it can get you that additional board certification and even more skill set and tools to approach patients with. And they go unfilled. So it's just people don't really know that they're out there.
So just so I understand this, all of these paths, regardless of the number, are 3 years? That's my first question. And my second question is, for board certification, is there a written test? Is there an oral test? Is there a practical? Is it a national exam? How does that work?
Yeah, so the two programs that are considered like 3 years long, which is O&M 3, or sorry, O&M 1, even I'm getting confused. O&M 1, which is combined. So let's say you want to stay at the same institution for your intern year and your OMM years. And this could be like West Virginia has this, St. Barnabas has this in the Bronx. That would be a 3-year program. O&M 2 is what I did. So I found another internship affiliated with PCOM in Philly for that year, so I didn't have to move. And then I did my 2 advanced years on campus at PCOM. So those 2 are considered like 3 years long. The O&M 3 is just that 1 year. So as long as you finish any residency, you can just do that 1 year to get your O&M board certification. And what the boards consist of is 3 components. So it's your oral, your written, and your practical. And so the practical is in person every year at AAO convocation. The board certifying body is the AOB NMM. And so they it's a national certifying body, just like, internal medicine, family medicine, every other specialty. And they conduct their practical exams on site at AAO convocation, but the oral and the written are done virtually, through testing software. So it is very comprehensive. They're looking at how you're doing the techniques. Are you knowledgeable? Are you doing them correctly and not dangerously? So that's about the boards.
Cool. All right, Alex. So tell us, let's go back to you. Tell us so you finished PCOM and now you're looking for a job. Tell us what that looked like.
Yeah.
People, it's not, as you said, it's not that common, a subspecialty and a very niche at this point skill set. Tell us how you went about finding a job when you graduated.
Yeah, I think I try to follow my own advice, right? So the advice I give to students is it's all about who you know, not necessarily about what you know all the time. You should know stuff, but who you know can be helpful. So I did a lot of, as a resident, attended a lot of conferences like POMA, OMED, convocation, and made sure to reach out to and get information from other program directors around the country, OMM chairs, reaching out to the board about available faculty positions. So for an OMM board certified position, there's, I'd say, a few main options of employment. Number 1 is basic cash pay OMM private micro practice, which I have done, in Philadelphia. I thought it was pretty easy to set up. You just need a table, a room, and billing and scheduling software. And then the second option would be joining a group private practice. Let's say, like, if Rothman wanted to hire, and I've been trying to convince them, I'm like, you guys really need OMM and acupuncture. And I'm sure they're looking at that. There's just not a lot of us who want to, work in that type of model. But joining a busy orthopedic practice, right, a group practice, or let's say a group OMM practice. There's those that exist out there, not commonly, but they do exist out there. And then a third option would be joining a COM or being faculty for an osteopathic medical school, which is what I did. Not right out the gate. I kind of found my way there after a year of private practice. but that's what I intend to do for the rest of my career. And those comms, really, really look for board certified NMM physicians. Whereas if you wanted to do OMM privately, you don't need your boards. Like you can do that stuff without board certification. But for accreditation purposes, if you're at a com, you need that board certification. So I would say what I did was I just literally on LinkedIn, I messaged my local OMM chair, Dr. Cooley. I was in private practice for a year in Cherry Hill, and this was during COVID. So it was really, really tough to make money because it's like they say, you eat what you kill, right? So if like there's no patients in, you're not making money. Patients didn't really want to see the doctor who was like hands-on right next to them during COVID for obvious reasons. So I was like, I really miss teaching as well. I think for me, I'm a teacher at heart and was missing out on that student interaction and passing down knowledge that I had been given by my mentors. So I literally messaged Dr. Cooley and I had an interview very shortly thereafter. So
And that's at Rowan.
yep, Rowan
Yeah.
Virtua now. We merged with Virtua a couple years ago, which is like a big, big health system in South Jersey.
All right, Alex. So first of all, this has been an awesome conversation. Thank you so much for spending time with us today. We really appreciate your time. Can you give us, this is our grand finale question. Can you give us one piece of advice? And it could be more than one if you want to give us more, but can you give us one piece of advice that you were given from someone else that you have found impactful in your career and you would like to pass on to our listeners?
Yeah, I gave this same spiel at OMED about the advice I got through my phone from Gary Vee. Somewhat of a, some people like him, some people don't. I like entrepreneurship and I like to listen to his advice and couple things. So like one thing is like if you're in your mid 30s watching this, he still is like you're a baby. He's like you're still a baby. You don't have to have everything figured out. He's like he was doing YouTube videos about wine until he was in his mid 30s before he became who we all know as Gary Vee. So he's like, first of all, you're just getting started. So don't freak out about where you're at. Don't compare yourself to these million and billionaires online. Other thing is to be fulfilled is to do something. I think number one that helps your fellow human being. Number two is that uses your own innate skill set and talent that you were kind of born with or developed. And number three is what you're passionate about. So the intersection of those three things, I think, is here's the cat again. Sorry, buddy. The intersection of those three things, I think, is what will create a lasting, fulfilling career where you will not burn out. Because I think we all have to look and be aware of burnout. So to do that, you need to follow your own intuition. And to follow that, you need to know yourself very well. I think a lot of people don't realize that maybe they don't know themselves as well as they thought. And they're actually listening to their best friend, their significant other, their parents, and putting that as a priority over what they themselves want and feel. So I think if you're feeling, let's take myself as an example, right? There's not many people who are going to be like, oh yeah, go be an OMM specialist because that's super well known and common. It's not. It's totally out there. I kind of knew that, but I did it anyway because that's what I felt was going to be staying true to myself and to what I want to do in my life and teach. And it worked out really great for me. And I'm still, I'm loving every day. Like, I don't even feel like I work. I'm just like shocked people pay me to do this and I'd be doing this for free anyway. So if you can find a career like that, where you're true to yourself, you're good at it, you're passionate about it, you don't get tired of the bread and butter stuff, and you're helping your fellow person, that's what you want to pursue or think about pursuing. Because, people told me, they're like, oh, why don't you stick with ortho? That makes great money. And, people look up to surgeons and I'm like, yeah, but like, that's not like what my passion's about. So that's kind of the advice I would give.
That's great. Alex, again, thank you for being with us tonight. We really appreciate your time.
Thanks for having me. This is awesome.